What is a patellar tendon rupture of the knee and what can be done about it? I'm Dr. David, orthopedic surgeon, sports medicine specialist, and author of the book, That's Gotta Hurt, The Injuries That Changed Sports Forever. I provide education, information, and commentary on all sorts of sports and exercise injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. Patella tendon ruptures can be some of the most devastating knee injuries that you can suffer. We've seen a number of pro athletes suffer these in recent years, and they're out for a year or more. Basically, it's a rupture of the tendon right below the kneecap. It helps you extend your knee, helps sort of transfer the force from the quads down to the tibia or the shin bone. And typically, it's a similar mechanism as what happens with an ACL tear. You land awkwardly from a jump and basically your tibia shifts and tears that patella tendon. Usually it's torn right below the kneecap. Here's the thing, that injury needs surgery. Yes, in theory, it would heal if we put you in a knee immobilizer or lock your knee out straight in a brace for 2 or 3 months, but not only would the risk of re-injury be high, but your knee would be really, really stiff. So we fix these injuries surgically, and it really needs to be done within the first week or 2 weeks, maybe at the most, so that it repairs easily. Basically, you go in, you open up the front of the knee, it's through a decent incision. It's not something that can be done through the scope. You put stitches in the tendon and pass those stitches into the kneecap either with anchors or through drill holes and tie the stitches at the top of the kneecap. Then you work to get knee motion back. You have to go slow with the knee motion to protect the repair. And as the motion gets stronger, you start working on quad strength. And then you start with things like jogging and more functional movements. But the overall process is long. It's usually a minimum of 6 months, but can be 8, 9 months, or a year. That's why the pro athletes, it's about a year before they're back to sports. It's certainly something that you can overcome, but it's a lot of work. If you suffer an injury, you have trouble straightening your leg or can't do it at all, definitely go see an orthopedic surgeon as soon as you can so that you can potentially be worked up and fixed surgically so that you can get back to what you want to do. Have you suffered a patella tendon rupture, and how did you do it, and how was it treated? How did you get back to sports and exercise? I can't give specific medical advice here, but I'd love to hear your experience. So in the comments below this video, describe it, share it. Not just so I can read about it, but people watching all around the world can learn from your experience as well. Now, I'd like to give you the #1 next step to help you overcome your knee injury. In the comments, or not the comments, but the description below this video, there's a link at the very top of the description. If you click on it, answer 4 or 5 questions, that'll tell me a little bit more about your knee injury, and then I can give you the #1 next thing to know or the next thing to do so that you can overcome that knee injury. If you like videos like this and you want more information on sports and exercise injuries, injury treatments, and injury prevention, subscribe to my video channel. I record several of these videos every single week and they'll get delivered directly to you. So click the subscribe button in the upper right corner of the page. Thank you so much for watching, and I look forward to seeing you right here next time.